Hello, friends. Welcome to yet another interesting episode of Healzen Podcast. Today we are going to talk about non-alcoholic fatty liver. मैं आपको एक स्टैट बताता हूं जो आपको शॉक कर देगा. इंडिया में 40% ऑफ पीपल आर अफेक्टेड बाय दिस नॉन-अल्कोहलिक फैटी लिवर. द ग्लोबल एवरेज इज 25%, बट इंडिया में ये 40% है, विच इज़ वेरी हाई. एक कारण इसका ये भी है कि नॉन अल्कोहलिक फैटी लिवर का देयर इज नो सिम्टम्स. पीपल डोंट रियलाइज कि उनको नॉन अल्कोहलिक फैटी लिवर है, एंड दैट टर्न्स इनटू अ क्रोनिक डिजीज. We have Dr. Apurva and Riya with us to discuss on this important issue of non-alcoholic fatty liver. Dr. Apurva, welcome to this show again.
Yes, thank you,
And
Mukesh.
fatty liver, non-alcoholic fatty liver जो है, it says we cannot reverse that thing and the person has to live with it.
Mukesh, let me tell you, this is not true. Fatty liver can be reversed. We have reversed chronic non-alcoholic fatty liver of many people. So we have evidences that it can be reversed. So let me explain you one case. We had a case where 40-year-old gentleman developed stage 2 non-alcoholic fatty liver along with obesity, diabetes and high cholesterol level. Also, he was facing autoimmune hepatitis.
So you said stage 2 non-alcoholic fatty liver. कितने stages होते हैं मैम?
So there are grading, grade 1, 2 and 3. So higher the deposition of fat in liver cell, higher is the grading. Higher the level of grading is, higher is the level of seriousness.
So grade 3 means the case is severe, right?
Correct. Now coming back to the case, when patient couldn't get expected relief from his treatment and medicine, he came to us. But till then the case was very chronic. After 8 months, we successfully not only reverted his non-alcoholic fatty liver, but we also reduced his diabetes, his obesity, his triglyceride, and we also helped to restore his autoimmune condition and avoided his liver cells to getting damaged.
Dr. Pro is truly magical. On one hand, we have this general opinion that non-alcoholic fatty liver can't be reversed. And the good team of doctors at HealZen is doing this wonderful job of relieving the patients of fatty liver. So how is that possible?
So Mukesh, again school. You have to listen to the science first and then tell me whether it is logical or magical.
Okay, I will listen to the science.
Our body is made up of trillions of cells. You have studied this in biology in your school. So cell make up tissue. Tissue make up organ. So liver is the organ, stomach is the organ, intestine, small and large intestine are the organ. All these organs make digestive system. There are other systems also, like endocrine system, circulatory system. All these systems togetherly make human body. Now it is clear that cell is the basic building block of human body.
I completely agree. Cell is the basic building block of the body.
Now again school.
Okay.
I would like to ask you one question. Which is the most complex organ of human body? Can you tell me?
I think heart, dil,
Anything else?
heart and brain. I think brain is the most complex part of our body.
Let me explain you. Whenever I ask someone which is the most complicated organ of the body, people say brain or heart.
Mm-hmm.
But let me tell you, liver is the most complicated organ of the body.
Oh.
Brain has 2 types of cell and heart has 4 types of cell and liver has 5 types of cell. When we talk about fatty liver, fat is deposited in the liver cell. In fact, liver has 30 billion of cells which are called hepatocytes.
Let that sink in. 30 billion cells.
So the fat is deposited in this hepatocyte around the nucleus, which makes this hepatocyte unhealthy. Now tell me, if this cell is unhealthy, will the liver tissue remain healthy?
No.
If the liver tissue is unhealthy, will the digestive system remain healthy?
No.
And if the digestive system is not healthy, will the person feel healthy?
Not at all.
So this is what we heal the person, we heal the body at cellular level. We treat the root cause so the reversal is possible.
So what is the root cause of fatty liver?
Mukesh, it might surprise you. Root cause of fatty liver is not in liver. Root cause of fatty liver is imbalance of gut microbiome. An imbalance of gut microbiome gives rise to metabolic disorders like diabetes, obesity, high cholesterol level, which are again contributing factors to fatty liver.
So, Dr. Purva, how exactly do you treat non-alcoholic fatty liver?
Usually, by the time people come to us, they have tried many treatments, many medicine, and they have many reports. The first thing our doctor do in clinic is that they take detailed history taking of patient. During history taking, we specifically ask patient along with his metabolic history that whether he is taking any medicines for long time. We also ask if he has habit of taking painkillers like क्योंकि अगर कुछ बॉडी एक हो या हेड एक हो पीपल हैज़ हैबिट दैट दे गो टू स्टोर एंड टेक द मेडिसिन बाय देयर ओन सो व्हेन दिस मेडिसिन्स आर टेकन for a long time, it may affect liver because liver is the primary site where metabolism of food and also medicines takes place. So when this goes to excess, it may trigger the signals like inflammation, fatty liver, and fibrosis. So this is what happen in fatty liver. Patient admits that they have never been through such a detailed history taking session throughout their disease treatment journey. The first thing we do is we start our protherapeutic protocol. Now let me explain what are these protherapeutic protocols. So HealZen's protherapeutic protocol are combination of different formulation made from bioactive compounds which also has help promoting medicinal properties. These protocols are safe, evidence-based and doctor recommended. And these are our patent pending formulations which have different types of therapeutic benefits.
Continuing, one of our signature formulations is for liver detoxification specifically. Based on our findings from the history taking session during the first consultation, we might also assign other formulations from the protherapeutic protocol. Referring to the case of the 40-year-old gentleman, which Dr. Apurva mentioned, he had stage 2 fatty liver, and along with it, he had presented to us with obesity, type 2 diabetes, hypertension, and high triglyceride levels. So we also assigned him some other formulations. So at HealZen, we heal hepatocytes by following the overall rule of CBAD, that's cleansing, balancing, activating, and defending. So cleansing is where we clear the cell of all the deposition of fat. Balancing is where we provide essential micronutrients and balance the pH of the blood. Activating is where we activate the cell for its optimum voltage for rejuvenation, and defending is where rejuvenated cell has enhanced defending power. The next thing is that we put the patient on a nutrition therapy at our functional nutrition therapy department. Functional nutrition therapy also supports metabolic restoration by addressing the root causes. Now, there are specific root causes which are true for fatty liver. The most important one is environmental toxins. Excessive exposure to non-stick cookware or BPS from plastic containers in storage, poor sleeping habits, poor eating choices like eating more of bad fats and processed fructose and sugar, leading a sedentary lifestyle, and overuse of painkiller medicines.
Doctor, in your experience, how much time is needed to reverse this fatty liver?
Let me explain this with two different conditions. If the condition is chronic along with metabolic disorder, it takes 6 to 8 months to revert the condition completely. We have also seen that it may take 1 year. In second case, if the condition is not chronic, it may be reverted in 2 months, provided patient should stay committed to the protocol.
Let me tell you one thing, doctor. I know people, those who are suffering from fatty liver for the past 3 years. 8 months is a boon for them. ये एक वरदान के रूप में ये therapeutic treatment आया है. Doctor, you mentioned non-alcoholic fatty liver will not show any symptoms.
Indeed.
So how do we determine that the condition is reversed?
Through lab reports, through ultrasonography, and if required, we also ask patient to go through fibroscan. So coming back to this 40-year-old gentleman who was having diabetes, obesity, and even high cholesterol levels, his sugar levels were also raised. His ALT and AST, that means liver enzymes, were raised, and his ultrasound was showing grade 2 fatty liver. This was all before starting our protherapeutic protocol.
Doctor, how often are the tests recommended to evaluate the protocol?
We ask patient to go through these reports every 3 months. In this 40-year-old gentleman case, after starting Healzen's pro-therapeutic protocol, after 3 months, we saw his sugar levels were reducing, his liver enzymes, that is ALT and AST, started coming back to normal, and he reduced 6 kg of his weight during this process. After 6 months, we saw the positive prognosis where healing was started. And after 9 months, we went through his ultrasound report and we saw that his liver was coming back to normal condition. So in this case, Mukesh, let me tell you that this patient came to us with autoimmune condition, and that's why the case was very challenging for us.
Ria, I have heard fatty liver sometimes advances to liver cirrhosis.
If neglected, yes, it does advance to liver cirrhosis.
So, do you treat liver cirrhosis?
We prevent fatty liver from going to liver cirrhosis. And in cases of liver cirrhosis, we can just support the liver health because from here the condition becomes irreversible.
डॉक्टर अपूर्वा, आई नो कि हेल्थ पे हम प्राइस नहीं लगा सकते, हेल्थ इज़ वेल्थ आफ्टर ऑल, बट आई एम क्यूरियस टू नो कितना कॉस्ट है ये फैटी लीवर को रिवर्स करने का?
It is much lesser than what you would spend otherwise.
Oh, that's great. If it is more economical than the other treatments, so that's really wonderful.
It is economical and it also treats the root cause. That is the another advantage.
Ria, is it possible if a person has reversed his fatty liver successfully, can it return?
Yes, there's a possibility.
So then what do you do in such cases?
See, when we reverse a certain condition, we put the person on a maintenance protocol where he is supposed to follow a food protocol along with lifestyle modifications. And people who have come to us with fatty liver are so thankful that they follow this protocol and no one has ever come back to us complaining about fatty liver.
Oh, that gives a lot of hope to all the people out there who are suffering from fatty livers. Thank you, Dr. Purva, Ria, for this very inspiring and hope-filled session. हमको बहुत बातें पता चली about fatty liver, non-alcoholic fatty liver. And those who want to reverse their condition, log on to www.healzengroup.com and book your appointments. Thank you.
Thank you.